Here are two high-yield USMLE-style questions focused on primary ciliary dyskinesia, PCD, including Cartaginer syndrome and related clinical findings. Question 1. A 10-year-old boy presents with chronic sinus infections, recurrent ear infections, and hearing loss. His parents report that he has had situs inversus, reversed organ placement. Genetic testing reveals a mutation in the dynein arm of cilia. Which of the following is most likely associated with this patient's condition? A. Defective ciliary clearance of respiratory pathogens. B. Dysfunctional eustachian tube due to impaired ciliary function. C. Increased fertility due to dysfunctional fallopian tube cilia. D. Impaired neutrophil migration to sites of infection. E. Reduced nasal nitric oxide levels due to defective ciliary function. Answer A. Defective ciliary clearance of respiratory pathogens. Explanation. This patient likely has primary ciliary dyskinesia, PCD, specifically Cartaginer syndrome, which is an autosomal recessive disorder caused by a dynein arm defect in cilia. This results in immotile cilia, which impair the clearance of respiratory pathogens, leading to recurrent infections such as sinusitis, ear infections, and bronchiectasis. Situs inversus is a characteristic feature of Cartaginer syndrome. Nasal nitric oxide levels are typically low in PCD, which can be used as a screening test for the condition. Question 2. A 25-year-old female with a history of primary ciliary dyskinesia, PCD, presents with infertility and a history of recurrent respiratory infections. She is diagnosed with dysfunctional fallopian tube cilia. Which of the following is a common complication of this condition? A. Increased risk of ectopic pregnancy. B. Increased fertility due to functional fallopian tube cilia. C. Chronic hypoxia due to impaired ciliary function in the lungs. D. Normal ciliary function in the respiratory epithelium. E. Decreased risk of bronchiectasis. Answer. Increased risk of ectopic pregnancy. Explanation. In primary ciliary dyskinesia, PCD, dysfunctional fallopian tube cilia impair the transport of the egg, leading to infertility. The dysfunction also increases the risk of ectopic pregnancy due to the failure of the egg to properly travel to the uterus. Women with PCD are at high risk for ectopic pregnancy and other fertility-related issues due to the impaired ciliary function in the reproductive tract. These questions focus on primary ciliary dyskinesia.